Students are using these shortcuts. They're not developing the skills to cope with life's challenges, but instead they're going to an escape. What is it doing to their brains?
Yeah, so the brain actually does become more sensitized to those shortcuts the more you use them. So, for example, in the case of nicotine and THC in particular, we've seen that if you use those when you're an adolescent and your brain is still forming, and that's actually a critical part to this, your brain isn't really done growing in certain places and pruning in others until you're about 25 years old. And so anytime you're putting a chemical into your brain that affects it before then, you are potentially altering how it grows. But when we put those chemicals in there in particular, we've seen that then when you later put it in front of a stimulus like a different drug, like cocaine or like opioids or something like that, we find that the brain actually lights up differently and you're more susceptible to addiction to other drugs. It's something that we call priming. But even outside of a biological side of things where you've got that priming effect, what you start to do is build this psychological pathway of thinking like, oh, I can't feel uncomfortable right now. It's not okay for me to feel this way. It needs to stop as quickly as possible. This is not an okay state to be in. And you start to lose tolerance or not develop tolerance for discomfort, which is just a really important part of being able to make it through life without getting really frantic or frenzied when you're put under pressure.